how does MMT, first, if whoever takes this question first, explain what that is, if you can, to the viewers, and how does it relate to Medicare for All? How could it help? How could it help make it possible? Which is something that AOC, whatever people think of her, she has pointed publicly to MMT as a way to make Medicare for All happen. This was back in 2019, so so go ahead, whoever wants to take the question.
Yeah. So again, and we said this earlier, modern monetary theory is what MMT stands for. Okay. But even the MMT community will tell you that we are a fiat currency. We spend money. Okay.
Can you explain what that is, fiat currency, for me and others?
So you can have a sovereign that is on the gold standard. And if you are on the gold standard, which the US was at one point in time many years ago, all of your dollars were backed up by gold, okay? Which means basically that you can't spend a dollar if there isn't gold in Fort Knox to back up that dollar, right? But that's not sustainable. Once you hit an economy that is, expanding exponentially, your population is expanding. You have the Industrial Revolution that we went through, and then you had all of the technology expansion, and then we had the service economy and all of the corporations that come into play, right? So at one point in our timeline, we converted to what we call a genuine fiat currency, which means that the dollar is worth what the federal government says it's worth. So in other words, $100, that piece of paper does not have gold in Fort Knox to cover the value of that dollar. That dollar has that value because the government, the federal government, says that is what that currency is worth. Okay. So that's fiat. What that means is if the government decides that they're going to fund a federal program, okay, say it's Medicare for All, then they incorporate that into the fiscal budgetary process. We have decided that as a federal government, we're going to fund this. And then they do a transaction that is all keystroke. Okay. Nobody goes to the printing press and cranks up the money for it. They do a credit to the program itself. And then they initiate legislation that allows that program to happen. Okay. So it's a appropriation of money to cover let's say it's an appropriation of funding to cover the program that you put into place. All right. Every government program that is enacted under a funding, because there are some programs that are not only using a currency issue, they might have other sources of funding, especially from a state program. The federal government would say, we're going to appropriate this much, and then to supplement this, you are to use these funds coming from X, Y, and Z. But every program that the federal government initiates, they will transact dollars to fund that program. And then they will set up a tax liability associated with it, because if you have too much money out in the economy, right, you're going to end up having inflation. Inflation comes around when you don't have enough demand for the money that's out there. So what happens then? People have too much money, interest rates go up. Now, interest rates go up for other reasons too, okay? But one factor is that there's too much money out in the general population, and that will cause inflation, okay? Mm-hmm. So you can't just do whatever you want. It's one of the reasons why they are supposed to come up with a budget, an agreed upon set of programs that people want and need. Now, people, us, the general population that needs basic human rights and a safety net to make sure that people are covered and aren't starving and aren't homeless, right? It's a choice as to what we decide to fund. Okay.
Wow. Yeah, I'm fascinated by that. I think, when a lot of leftists, including myself, when it's said, how are you going to pay for it? Well, we always point to, well, look at the military, look at how much we give to the Pentagon, et cetera. But when you put it in context of MMT, it's even more impactful and powerful. Like, clearly we could. So
Right.
yeah, I really appreciate that that explanation for sure. Not to totally switch topics, but I do want to emphasize, and I saw this in the chat too, talking about, well, something can't just be one day. But that's the point. It's not just one day. It wasn't just one day of marches. So if you guys can talk about, and Colin, if you can put on the screen at the same time the petition and the demands. If you guys can talk about the petition that you had set up and the demands, and then get into the UN piece.
Yeah. So the petition, we have 3 lists of demands. The first one is, if you scroll down there, is to, number 1, is to pass and improve and expand it Medicare for all immediately. And all the members of our team and our coalition, we all send each other emails, phone calls, text messages. What should be in it? What should be in there? What should be included? So we literally put down 0 copay, 0 deduction. We have a laundry list of different things. The second thing we put in there is that we want our federal government to recognize healthcare as a human right, which I think is pretty simple. And the third is prioritize healthcare in the federal budget. So we have the federal government have their spending. We want healthcare to be number one. Number one thing they focus on would be that. And we also wrote down all the language that we want there. So it's not including, it's including, making sure we have enough hospitals, making sure we can fund doctors, make sure people can go to school to actually become a doctor and be a nurse. All that really includes that. So Lisa talked about the infrastructure. We know we don't have the infrastructure. We know that it's not going to take tomorrow and we're going to have enough doctors or have enough hospitals. We understand that. It's going to take time. But again, as she said, if we can't get it on the House floor, it's going to take even longer to get there. So again, we're not saying that, we're not asking for, a magic wand here. We're just asking to at least pass it. And then we can talk about the nuance of where do we go from there? How many hospitals do we need? How many doctors do we need? We can break that down and we can have a discussion about that, but we still need it to pass first before we even begin to even have a discussion. We can't even have that discussion. We can't even get a vote for it. So it doesn't really make any sense either way. So we didn't hear a response back. So now we're going to take our demands to the UN and let them know that this healthcare is a human right. The United States government does not recognize this. I do have some ideas about how to move forward after our complaint is filed. We're going to talk about more demonstrations and some further actions to help amplify not only this action, but also put noise on the fact that the United States government refuses to recognize healthcare as a human right. So I do want to reach out to folks internationally and let them know that, this is a problem here in this country, And so I think that having more allies, not just here, but also foreign as well, would be really important for the movement.
Yeah, the NHS is under attack, you guys. They're trying to privatize it just like they did here. And what they're doing right now is starving it so that they can fire sale it off. And if you have any understanding of what kind of pressure we could get if we teamed up with everybody over there that's terrified of losing their NHS safety net, push them. Go, on Twitter, there's @NHS, a bunch of stuff's going to come up.
A lot of times.
We need synergy.
Yeah, we do. And a lot of times on the Red Berets, we'll peek over and see, because we have some people that we follow and that have been following us. Sometimes I'll just do hashtag save the NHS, hashtag Medicare for all. Like, that's just a good thing, because we
They
want to
started-
show solid. Go ahead.
I'm sorry.
No.
We do want to show solidarity, but some of the folks from the NHS, I don't know, I'll just say the cheerleading squad over there, because they support the NHS on an organized level. They
Right.
were pushing the march for us.
Yes.
They wanted to
Right.
help
Yes.
us, know,
Right.
and that's what works, you guys.
Right.
It's not just your people in your community. It's people
Yeah.
over in Europe have this. They watch us talk about how ridiculous it is to
Right.
walk into an emergency room and be turned away because you don't have insurance, even though that's illegal. It still happens,
Right.
right?